It's always nice to know there are places you can go if you have a medical problem that can help you out, and the Cardinal Free Clinics down the peninsula around Stamford and other locations are places that you can go, and from those places are Dr. Lars Osterberg, nice to have you here, Lars, and Dr. Kengatharan, and they are both involved in this project. Now, I was a little confused when we first came in about the locations that you have. Ken, why don't you fill us in on that a little bit?
Well, there are two locations for the clinics that are come under the umbrella of Cardinal Free Clinics. One is in Menlo Park, co-located within the VA, and the other is in San Jose. And the one in San Jose is called Pacific Free Clinic, and the one in Menlo Park is called Arbor Free Clinic.
Okay, and Lars, you were teaching at Stanford and also in medical practice.
Yes, and at the VA hospital, I'm chief of general medicine there.
Okay. What's happening with the VA hospitals these days? Just give us a quick rundown on that.
The VAs are doing great. High quality health care, one of the excellent medical record systems, and really have improved significantly.
Yeah, they have. That's what I've heard. Okay, the free clinics now, people can come to any of these clinics and get the kind of help they need. Generally speaking, who are your patients?
Generally, they're the underserved, those without insurance, often homeless, nowhere else to go. Those would otherwise go to the emergency rooms.
Okay. And you find the same thing to be true?
Absolutely. These clinics were actually created in the spirit of Jane and Leyland Stanford in terms of what they wanted to do for the public welfare. And I think that we carry on that spirit and ambition.
Okay. You tend to get the same people over and over again?
Not necessarily. We actually try to get them into the healthcare system that's already existing, but not always are we able to do that.
Are you able to get them into the healthcare system in many cases?
I would say in some cases, but as you know, it's often hard to get insurance.
Right.
The county systems are very full, and there's no other alternative for them than to come back.
Well, there is, I think, generally agreed a health crisis
right.
In the United States and in California, certainly, and people who don't have insurance, I don't know how many thousands and thousands of people who do not have insurance, they have to rely on clinics and so forth. Somebody comes in, they've got a sick child, for example.
Right.
This happen?
Right. Very often. Actually, now there is healthy families, so we can get them into healthy families, but we can do the screening, we can help them navigate the system, because it's often hard for them to even know how to get into the system and apply for these programs.
Yeah, and so Ken, you would be sort of a counselor also at the same time.
No, I'm very much an advisory board member for the clinic, and helping them to think like business folks, bring in the efficiencies of a business operation into the clinic in terms of communication, and also helping them raise money.
Yeah, okay. Raising money is always an issue. I mean, because more people without health insurance are going to turn to clinics, and obviously it takes money to sustain a clinic.
That is correct, and Lars can probably fill you in on the sources of funds.
Yeah, our sources of funds are the Stanford University. They provide in-kind support, a lot of financial support to run the clinic. The VA provides the space, and we have two current funders, the Health Trust and the Leslie Foundation. However, these patients require medications. Those often are expensive and difficult to obtain, and often we require then to other sources for income.
Do you have fundraisers for that?
We do.
Students, obviously you have donors, but I mean, do you also have fundraisers?
We do. We dedicate students to that role. We have other faculty in that role, and the Office of Medical Development at Stanford in that role.
Okay. You serve a major function in the society because of the fact that so many people, don't have the wherewithal to do it, and with rising prices with medicines and so forth. I'm glad to see this happening. And the two locations, again, quickly, are what?
Menlo Park and San Jose.
Okay, and we wish you the best, and thanks very much for coming, both of you. Okay,
Thank you.
Thank you for joining us.